Okay. If we want to go ahead and take seats, it's 11 o'clock. We'll try to get started on time. Thank you. Awesome turnout. Thank you. Thank you for being here. My name's Phil. I'll be taking care of you today. Can I get you started with some appetizers or some drinks for the table or anything? No, we're good. Well, drinks would be nice, but we do have lunch later. No food right now, but we do have some food for thought for you today. Hopefully by the end you'll get to connect and think about the future. We have some really good experts here. Dr. Romanek is with us to talk about what's in store in the next few years in terms of infectious diseases. We have some great breakout sessions. Thank you to all our breakout speakers. But I also want to say thanks to our planning committee members, Faith DiNardo, Amanda Yost, Carol Nungesker, Ifani Wachukwu, and Sharon Schaefer. Round of applause, please, for those folks. This is a big, thank you very much. And thank you to the catering folks. Thanks for all the dignitaries in the audience. I know Mark Samodi is over there. If you have any information, or you want information about American College of Healthcare Executives, students especially, go see Mark over there. He just stood up in the back. But thank you to our co-sponsors as well. Community Division of Wellbeing, the Graduate College, University Libraries, and the Center for Regional Development all kicked in some funding for this program and this event. So we appreciate that support for sure. And I'd like to thank also Freddie and Frida. Why don't you come on up stage here, guys? Yeah, thank you. Always a treat to see the mascot, the birds, our fighting falcons. Thank you, guys. Yeah, do you know what this conference is about? Well, it's about, part of it is about bird flu. Do you know anything about bird flu? No. Not that kind of flu. Not that kind of flu. This is more like a virus type of a flu, so, yeah. Oh, okay. We'll see you later then. Don't walk away from your problems. Cognitive avoidance is not going to work. We have to face our problems head on. Okay, well, that went about as how I thought it would. Thank you. Thanks again for being here. My name's Phil. Does anyone need an appetizer? No, I already said that. Okay. So I'm going to bring up the agenda, and so we have the keynote address that'll go until noon, and then we have some student awards to hand out, and lunch will begin hopefully 12:15, and then the breakout. So I'll come back and I'll inform you where the breakout rooms are located as we're wrapping up the lunchtime. So bathroom locations, there's bathrooms out those doors and those back doors, but the closest ones are there. There is a unisex bathroom right below us, so you can use that as well. Please silence your phones. The symposium recording is happening, and that will be posted on Public Health Matters, bgsu.edu/Public Health Matters, so you can watch that later. Continuing education, you need to fill out the evaluation, and I will remind you of that at the end of the keynote address. So at this time, I'd like to bring up the Dean of the College of Health and Human Services, Jim. Oh, sorry. Thank you. Yeah. Actually, we're going to have Wood County Health Commissioner Ben Robison come on up, thanks, and say a few words, because Ben had more than one hand in shaping the direction for the symposium, so thank you, Ben. A round of applause for Ben. Yeah, and then introduce the Dean.
Good morning. Thanks for allowing us to be here, and it's really a privilege to just speak to all of you. I have the privilege of serving every day as the Health Commissioner for Wood County here in Northwest Ohio. And what I have seen with Bowling Green State University is a university that is really committed to its mission statement of being a public university for the public good. And this has been a long-standing tradition here, the Ned Baker Symposium for Public Health. And so this is a particularly important year to be able to be here. And what I wanted to speak to as we're getting into our content today is this idea of how do we position ourselves as public health agencies in the landscape of everything that's happening within our communities. I remember after we were coming out of the COVID pandemic, being at a conference, and a colleague of mine was asked a question, and the question went something like this: how do you feel about, or how do we navigate this shift where public health has become so much more political than it used to be? Like, we're not a political discipline. How do we navigate this shift? And his answer really surprised me. What he said was, well, public health actually is political. We need to recognize this, because if we don't embrace it and recognize this, we're never going to be able to make the steps and engage the stakeholders the way we need to. And I'm going to tell you, when I first heard that, I really didn't like that answer. I kind of bristled at it, because I was thinking about it differently than I think he was. And so as I sat with it longer, I realized that he was really right, that public health is, by nature, political. We are, at the local health department level, at the state health department level, creatures of statute, put into effect by laws that are enacted by legislators, signed into force by governors, right? And this is something that is a largely political process. We enact policies in our local communities. These policies move people through changes that require engagement of community leaders and organizations, elected officials. And so as I began to think about it, I realized, you're right, we are political. But we as health departments and public health practitioners also have an obligation to be nonpartisan. And I think that was what I had conflated. I'd assumed that being political and partisan were the same thing, but they're not. And so in the time after COVID, I think we've seen a doubling down now of public health practitioners recognizing that it's important to navigate the political environment, to really be well known by and well known to our leaders at every level, both political and otherwise, because that's how we gather the buy-in to move the community forward. And so even as we see changing agendas and changing landscapes, our ability to remain focused on health, which is a value across the political spectrum, across the partisan spectrum, positions us to navigate those political structures effectively and to get results that aren't just aligned with one party's platform or another, but position us to serve our whole community well, which is what we're here to do. And so just want to say thank you as you're here to learn about infectious diseases and to think about our ability to position ourselves in the political landscape from a nonpartisan lens as we go through addressing these challenging infectious disease issues. I now have the privilege to kick us off and to invite up Dean Jim Ciesla, the Dean of HHS here at BGSU. Thank you.
Thanks so much, everybody, for being here. It's really good to see you, faculty, staff, students, but especially our guests from off campus. Thanks for being here. You're most welcome at BGSU. We're very proud of this lecture. I have two jobs. I'm going to give you a little bit of background, and then I'm going to make an introduction. So the Baker Lecture in Public Health is now known as the Public and Allied Health Symposium. The reason for this is that the endowment that was supporting it has changed to a professorship. And Phil, Dr. Welch, was a little bit modest to say this, but he is the Ned E. Baker Professor of Public Health based on that endowment, and we're very proud to be able to offer that professorship in our college. This symposium itself was established in 1999 to honor Ned Baker's many contributions to the field of public health. Ned received a Bachelor's of Arts degree in 1950 from Bowling Green State University and a Master in Public Health degree in 1954 from the University of Michigan. In December 2009, he was presented an honorary Doctor of Science in Public Health degree from this university, from BGSU, and in April 2010 was named one of BGSU's most prominent alumni. Ned passed away in December. We're very sorry about that. Ned was a really good guy and a very strong supporter, and we'll miss him very much. The BGSU College of Health and Human Services is proud to keep Ned Baker's legacy alive through our annual symposium and keynote address. This is the biggest event for our public and allied health programs, and we're always glad at this time of year when we offer the symposium. Thank you for being here today. Now I'd like to introduce our Ned Baker Scholar for the 25th Anniversary Symposium, Dr. Nikki Romanek. Dr. Romanek is a Distinguished Senior Fellow for Global Health and Security at Brown University. She most recently served as the Special Assistant to the President, Deputy Director, and Chief of Staff for the Office of Pandemic Preparedness and Response Policy, OPPR. at the White House. In this role, she led the recruitment and establishment of the inaugural office, driving key initiatives to enhance national preparedness and response to outbreaks, pandemics, and other biological threats. Dr. Romanek's unique blend of strategic vision, operational excellence, and dedicated leadership continued to drive significant advancements in public health, underscoring her commitment to safeguarding communities and improving the health outcomes worldwide. Thank you very much, Dr. Romanek, for being here. Welcome up.
All right, is that good? Okay. That was quite an introduction, thank you. Nobody likes to hear their bio read out loud. It's uncomfortable. So I wanted to take a quick moment just to thank Dr. Welsh and also to thank Ben Robinson for being here today. Nice to meet you. And Dean Sesla. Did I get your name right? Sesla. I appreciate the warm welcome, and I'm very excited to be back in the Midwest. I'm from the Midwest, not Ohio, Nebraska, but same friendly culture and same friendly faces, so it's good to be back. So I'm going to start off today with a little bit of a nursery rhyme and bring everyone back to the days when they were all children. Ring around the rosy, pocket full of posies. Ashes, ashes, we all fall down. Ring around the rosy. Some believe this refers to the red circular rashes that were a symptom of the plague. Pocket full of posies. This is thought to symbolize the practice of carrying flowers or herbs to ward off the disease, which was believed to be spread through bad air. Ashes, ashes. Or the British version, a tissue, a tissue. One theory suggests that this refers to the cremation of bodies during the plague, while others suppose that ashtu was a sound of sneezing, of course, a symptom of the plague. We all fall down. This is interpreted as a reference, of course, to death. About half of society believes that this sweet nursery rhyme is actually about the bubonic plague or smallpox. And the other half believes this nursery rhyme is actually about ritualistic dancing. I would like to make a similar comparison regarding what people believe about COVID. Many people believe that it was nothing more than a bad flu, and others believe that the COVID pandemic was the worst pandemic in history. Neither are particularly accurate, in fact, but both show what a divisive world we are now living in. Living in this divisive world and divisive time makes preparing for pandemics incredibly complicated and difficult. So now seems like the perfect time, why not, to discuss where we are in global preparedness. Better now than any other time. The state of global preparedness for the next pandemic. It's really a mixed bag. We have progress and we have challenges. While many countries have learned valuable lessons from COVID-19, significant gaps remain. Are we prepared for the next pandemic? This is a question I get asked 76,000 times a day. Are we? Well, that depends on where you live and what your perspective is. Let me lay out 3 ways in which I believe that we are prepared for the next pandemic, or at least we are better prepared for the next pandemic. I'll touch on these. There are more, but I'm just going to touch on 3 today. There's been increased awareness and political will from countries around the world. COVID made everyone pay attention and invest in pandemic preparedness. COVID woke everyone up from the slumber that they had been sleeping for 100 years. governments, health agencies, organizations like WHO, the World Health Organization, prioritized pandemic preparedness. I'd be a fool if I didn't highlight that this needs to continue. And in June of last year, WHO revised their international health regulations to strengthen legally binding rules for public health emergencies. Those take into effect September of 2025. Fingers crossed. Number 2, improved surveillance systems and technologies. Of course we have improved surveillance systems and technologies. I think any person I ask in this room will say yes. I don't know if they'll know exactly which systems, but everybody knows that while we were building the plane and flying it, we did improve some things along the way. We've improved surveillance systems, and many rapidly grew over the past 5 years. Yes, it has been 5 years. These systems have allowed us to begin to build a multifaceted, robust early warning system. And early warning is the key, the biggest key to detecting these things early. I will touch on a couple of examples today, but let me tell you, there is a list of 15 to 20 different examples I could go through, but I don't want to bore you. Just to touch on a few, WHO's Global Influenza Surveillance and Response System, which is a global disease surveillance network that has now expanded to cover a broader range of pathogens. In addition, we have advanced genomic sequencing technology, which allows for faster detection of novel pathogens. And let's not forget wastewater surveillance. Poop. Who would have thought poop was one of the most important things that we got out of COVID? It's true. We now have wastewater surveillance not only in America, but we also have it on airplanes that everybody flies and they don't even know it. The airplanes travel around the world, and there is now a traveler-based genomic sequence program surrounded about this. This system was originally only used for COVID, which you'll notice a theme. Many of these things were only used for COVID. But then it's now been leveraged, and it's exciting work. It's been leveraged for Clade 2 mpox. It's been leveraged, and it's currently being leveraged for Clade 1 mpox as well. It's been leveraged for flu, both A and B. It's been leveraged for H5N1, also known as bird flu. That's why Frida ran out earlier. And it's been leveraged for RSV. And when you think about it, it could be leveraged for so much more. All we have to do is keep working at it. We have the science. We built it. We cannot let it go. With this technology flourishing, now is the time to build a biosurveillance system, a real one, a system that talks to all the other systems and integrates all the data together. It sounds really easy. It is really hard. But now is the time. We have the systems in place. Now we must integrate them because, after all, this is one of the wins from COVID, if there were wins. Now let's talk a little bit, one more thing I'll touch on quickly, and then let's talk about maybe some of the things that didn't go so well. Vaccines and therapeutics development. That's the last thing I'll chat about. The single thing we need to know and understand in the last 5 years was that, of course, we were focusing on vaccines and therapeutics for COVID, for mpox, and for avian flu. But the goal of all of that work and all that preparation was to be better prepared across a range of pathogens, not just the pathogens that are staring us at the face, in our face. Science and technology used over the past 5 years is now being leveraged for future threats and has accelerated many efforts globally. Just to name a few examples that I'm personally proud of, although I'm not biased, I promise, but these are the ones I'm going to mention. There are many others. The organizations such as CEPI. Anyone ever heard of CEPI? You don't count. Besides the person that escorted me here today. CEPI is the Coalition for Epidemic Preparedness Innovations. They are an organization that focuses on preparing vaccines for disease. Hello? My mic's out. We good? Okay. For disease X. It's incredibly important that organizations like this focus their entire energy on disease X. There's also something called the 100-day mission. And in 100 days, there's a global effort to develop vaccines, diagnostics, therapeutics for any new pathogen within 100 days. Seems like a lofty goal. They've continued to work on this over and over and over again the last 5 years, and they will continue and double down now that we are in what we like to call peacetime and not actually in an emergency response or pandemic. And countries, let's not forget about them. They've all made a lot of investments to build out their own vaccine infrastructure instead of relying only on the United States. So they can build vaccines faster themselves. For example, the platform for mRNA technology, which was used during the COVID pandemic, now enables faster vaccine development, and multiple countries are now focused on what this manufacturing capacity could look like in their own country if and when the next pandemic happens. And our ability to make monoclonals, which is something that used to be a very rare word before the COVID pandemic, that ability has skyrocketed. We are just better. We're just better at it. And there's different countries working on different monoclonals, faster, better. It's an incredible time for breakthrough, scientifically speaking. Now that I've highlighted all the strengths, and you can tell how excited I am, I'm going to talk about some of the things that are gaps, and actually some of them that are weaknesses. And most of them are why we are in the place that we're at right now. So just like I talked about 3 strengths, I'm going to talk about 3 weaknesses. There's more than 3, but you'll get the gist of why I picked these 3. Panic and neglect. Panic and neglect is often used to describe how we handle a traumatic situation, specifically when it comes to a pandemic. Over the past 100 years, we've all witnessed a vicious cycle of panic and neglect. People are currently in the... Hello? Are we back? Okay.
Dr. Romanek, sorry about this, guys. I know this side of the room, the amp, apparently there's something wrong, so can you start over? No, just... just kidding. Can you hear me over here if I'm doing like this? So, Dr. Romanek, maybe would you this is going to be awkward, but could you just use this microphone maybe?
I can use mic.
There's either something wrong with the lectern or the amp over here. So let's turn that one off. I know you're going to have to, I would stand here and hold this. Sorry about that. Yeah, and then just.
All right, is that better? Okay. Scream? Okay, okay. Panic and neglect, where were we? So people are currently in the neglect cycle. And what does that mean? It's understandable. People are sick and tired of hearing about the word pandemic, the word COVID, the word preparedness, and the word outbreak. And they certainly don't want to hear about anything else that's going to affect their lives as much as COVID has already affected their lives, and as much as COVID has already taken away from their life. And that's completely and utterly understandable. And people are going to need time. It's been 5 years, but people still are going to need time to grieve whatever losses they had during COVID. But it is time for us to break the cycle, at least for us in the business of protecting the health of Americans and those around the globe. People can be done with pandemics and over it, but public health must continue to make sure that we are better prepared next time than we were this time. And in this complicated, so complicated, and challenging time, this might be one of the most significant gaps. Might be, I said. Just wait to what I'm getting to next. History is filled with lessons forgotten, not lessons learned. When the next pandemic comes, remember I said when, not if, when the next pandemic comes, we must be ready and not forget all we have learned the past 5 years, the good and the bad. Number 2, coordination and governance. Pandemics impact all of society in every single country. So coordinating among all agencies in every single country is required. We need to do this because pandemic threats will only increase due to climate migration and globalization, among the other changes in the ecosystems. Global response efforts are still fragmented, even after everything we went through, with no centralized authority to enforce preparedness standards. Some countries prioritize national interests over global cooperation, which is, of course, understandable, and it's not only natural to prioritize your own country. But unfortunately, for low and middle income countries that remain underfunded and vulnerable, lacking access to basic diagnostics, vaccines, and treatments, the lack of equitable vaccine distribution during COVID-19 exposed serious flaws in global distribution systems, and those flaws have not been fixed. And now for the hardest one, misinformation and public trust. According to a recent study conducted by the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine and the Africa CDC, in the past 2 years, Africa has seen the most significant sustained drop in routine childhood immunizations in 3 decades. Approximately 6 million children are missing getting vaccinated for preventable diseases such as tetanus, polio, diphtheria, and of course, the last one everybody in this audience could guess, measles. Vaccine hesitancy and widespread misinformation will undermine future public health responses if we do not focus. I mean truly focus and dedicate as much time communicating with people as we are dedicating to science and innovation. Yes, you heard me right. We need to communicate with people and spend as much time talking to people as we are in labs working on the new innovative science and technologies. You can have the best vaccine that's ever been created with an impeccable safety profile. But if you do not have the trust of the population that you are trying to help, that grand vaccine is useless. And the trust in public health institutions varies significantly from region to region across the globe. We all know public health didn't do a great job communicating. Basic communication principles were lost. They were abandoned. We lost our way and didn't communicate often, honestly, transparently. And when we took a misstep or learned science had changed, we didn't communicate the moment those facts changed. All of that has now resulted in a lack of trust that took a moment to disappear, but will take years to earn back. But one thing that has moved the needle, one thing that I have watched move the needle, and I've seen it move more than once in my career, and it's probably the reason why I still get very excited every day when I wake up. The importance of community engagement. I know everybody comes up here and talks about how important community engagement is, but I'm going to prove to you why it truly is sometimes what makes a decision for a person, whether they protect themselves or they choose not to, especially when it comes to health equity. Many people in our country are not plugged into the healthcare system. In fact, roughly half don't even have a healthcare provider. The statistics are significantly farther worse in other countries. It breaks my heart what the statistics look like in other countries. We need to make sure we are engaging with organizations and people that serve those communities and are actually trusted voices for those communities, and make sure that we are communicating effectively to those communities. But not just communicating, Instead, we need to be meeting other needs of those communities versus just the needs we think they need. Part of my work while at the White House, both working on the Mpox response and standing up the pandemic office, was focused on deep community engagement across different outbreaks. Different outbreaks affect different communities, different people. Making sure that we know how to reach a wide range of community leaders and making sure we are engaging with them on a regular basis, all the time, to the point where they're annoyed with us, perhaps. Not just during an outbreak, but engaging with them when there isn't an outbreak, so you can build a core relationship. Engaging them and learning from them about their community and what their community actually needs versus what we think they need. Whether it's housing, or it's bed nets, or it's an escape from the stigma that their population is facing every day. I'm now going to tell you a little bit of a story of something that I experienced when I was on the Mpox team at the White House. So early on, after we had vaccine access, which was a couple of months in during the response, we noticed that African American men were not getting vaccinated. We thought it was an access problem. We checked every street corner. We tried to put it everywhere we could. We realized African American men did not want this vaccine, this monkeypox vaccine. And so what did we do? Seeing that sharp of a decline in one specific population so quickly is kind of terrifying when you're in the middle of an outbreak. So we reached out to every single African American leader across the globe that we could find that would come and talk to us. Had a large, very large Zoom call, I will say, with multiple pages of screens of humans, and asked them off the record, what's going on? How are we screwing this up? Tell us what we're doing wrong. What are you seeing in your community, and how can we help? How haven't we helped? The answers we got were fascinating. Immediately, they started opening up. It was a safe space. It was only my colleague and I on the phone. No one else was there. They told us that monkeypox is stigmatizing to them, and they don't want to get a vaccine that's called a monkeypox vaccine. It's traumatizing for them. And then when they get the vaccine, they have a scar or a keloid that is very noticeable. And they don't want that. They don't want to be marked for the rest of their life just because they need that vaccine. And so, after hearing this, and let me tell you, this is not what I was expecting to hear. After hearing this, immediately, we got off the phone with them. We called FDA, we called CDC to find out what could we do for them. How could we make this better? And I reached out to WHO, quietly, perhaps, and explained that the word monkey was actually highly stigmatizing to African Americans, and it was the sole reason why African American men were actually refusing preventative treatment. And some were refusing to actually go to a healthcare facility to get any treatment after getting Mpox. Monkeypox, so it was still monkeypox at the time. We asked WHO, what can we do about a name change? First response, name changes take a very long time. How long? Like a year, over a year. We're not sure, we'll get back to you. Okay, not great. We're in the middle of an emergency response and we need these guys to get vaccinated so that we can protect them. What's gonna work? And from that moment on, I had that same conversation every day for about 95 days straight. You know what worked? In November, WHO changed the name to Mpox. And during that 3-month period of time, we worked with FDA and CDC to figure out how to give shots to people in places that are not regularly noticed. It changed the landscape of vaccine uptake. We immediately, within 2 weeks, saw a shoot up of vaccines, specifically in African American men. I don't tell you the story because, oh, we did an amazing job and we are the best at this, and I'll just drop the mic now. I tell you the story because we went so deep into community engagement that they trusted us. It can be done. I was the last person that they thought would be on that phone call asking them those questions, and they still opened up to me. And when I went back and told them, here's the plans, we have everything sorted, they were shocked. They weren't used to that. They ended up being, we had 3 people on the MPOX team. That community and that engagement we used to call our 4th seat in our room. We were in a very small hidden room in the White House, all sharing desks that were all facing each other. And there was an empty seat. And we used to call those trusted messengers our 4th person on the team because they truly ended up doing that. Not only did they get vaccinated, but because they believed what we did when we followed up, they told all of their friends. And so they got their entire communities vaccinated. Not because we told them to. They chose to get their communities vaccinated. We had them texting and reaching out to us asking where vaccine clinics were. It was incredible. So my assessment, despite improvements in surveillance and vaccine technology, the world is still not fully prepared for the next pandemic. We are significantly better off, but success depends on sustained global cooperation, continued investment in healthcare infrastructure globally, and addressing the trust deficit every single day. Preparing for the next pandemic will require a multifaceted, all-hands-on-deck approach involving governments, international organizations, private sector, and civil society, which most of you have already heard before. I think without question, we are better prepared than we were 5 years ago. But we can't forget the things we learned over the last 5 years, the things that excelled, the science and the innovation that we learned, but also the things that didn't go very well. And we must continue to invest in preparedness. Preparedness is like a circle. There is no beginning and there is no end. There's no stopping preparedness. If you stop preparedness, you have to start all over again. Now let's talk politics. The current US political climate makes everything I just said really hard. It makes everything really challenging. But it doesn't mean that we give up. The US is facing real challenges with the recent reduction in workforce. It will take time for this government to restructure, to reacclimate to this new reality that they're all facing. In addition, the US recently left the World Health Organization, which will have massive consequences on our capacity to prepare for and respond to pandemic threats. We have no eyes or ears on the ground. And if we still wanted to share information like we used to in the good old days, and information and technical expertise, that would require that we have 193 bilateral meetings per year at minimum. That's just talking to each member state once, instead of using the mechanism of the World Health Organization. Sure, the World Health Organization has things they need to reform, and they need to improve on certain things. But we should be at the table helping them reform and helping them improve those things. Unfortunately, the next pandemic may not be patient and may not wait for us to have that 193 different meetings. But here's what I can say with certainty. Pandemics are global by nature, and no country can solve them alone. As a wonderful colleague of mine often says, there is no US solution to a global pandemic, but we do need a global solution. Pandemics don't care about politics, but we know public health gets caught in the middle. How can we keep pandemic preparedness focused on solutions instead of letting it become so divisive? That's a hard question. I don't know why I asked it to myself in a speech because I don't have the answer to it. But that is the question that I pose to all of you because I don't have an answer. It's something I think about a lot. It's something that keeps me up at night. But I do have thoughts on how to focus our energy and some suggestions on where to go from here. Here at home, we need to continue to do outreach. I know, I keep talking about outreach, I'm sorry. But we do. Our communities, reaching our communities and helping them understand that the work of preparedness is to prevent suffering in their own community It starts with your own community. Global health isn't a partisan issue. The viruses don't care whether the state is red or blue. And the viruses don't care if they crossed a border from one country to another. Vaccines also don't care, by the way. It is important to engage people and reach people across the political aisle. Don't be afraid. We have to get back to a place where pandemic preparedness is a bipartisan issue, where everyone sees the value of it, because in the next big pandemic, this is going to be critical to saving lives. We must remain resilient as a community that cares about global health. And that means being innovative in our approach moving forward. The U.S. can and still should be leading. This is an incredible place with an incredible amount of expertise and capabilities. And this country has to offer this to other countries. It is our responsibility, it is good for the world, and it's good for us when we are deeply engaged in the world. And in this current time, that means more bilateral relationships and continuing to work with multilateral level organizations, such as the World Health Organization, Gavi, or the Global Fund, just to name a few. That also means creating our own coalitions among academia, non-government organizations, and private sector, and collectivizing research that is happening in universities across and sharing the information with all of our partners so that everybody knows what each other is working on. And filling governmental gaps with private sector. Private sector did a lot during COVID, don't get me wrong. But if we end up in another pandemic and we are in this political climate, private sector is going to have to find ways to come together even more. And discovering how best to engage with the other countries and carry out their mission to protect those abroad, and ultimately to protect those within our own country. The gap left by USAID will never be filled fully, but it is our role to try to mitigate the negative impacts of its loss. We are not alone in this world, and if we really want to keep Americans safe, there must be an ongoing global strategy that engages other countries and engages multilateral organizations. Americans cannot go to this journey alone. That is one thing that is absolutely critical for people to understand if we are going to make a healthier world. Now let me leave you with another nursery rhyme. Eeny, meeny, miny, moe, catch a tiger by its toe. If it hollers, let him go. Eeny, meeny, miny, moe. If the tiger is the next pandemic, do we want to leave it up to chance, or to eeny, meeny, miny, moe, as they say? Leaving it up to chance would not let us control who or how much of an impact that tiger has on the world. Or another option, do we want to use all the lessons learned and leverage the tools and resources that we've invested in over the past 5, 10, 15, and even 20 years? And rather than just catching the tiger by its toe, we fully wrestle it to the ground and save lives in the process. Thank you. Try this one again? Let me try this one.
Thank you. How we doing? Over on the other side, my sincere apologies. I guess an amp blew maybe 5 minutes into the talk, so this is recorded, so you will be able to go on that website, bgsu.edu/publichealthmatters, and you can watch the recording. Should be available pretty soon after today, so keep that in mind. But I'm going to do a quick question and answer. If anyone has questions for Dr. Romanek, please raise your hand and I'll bring the microphone around. And are you able to hear me over here, Emma? Okay, so we'll try to speak up real loud into the microphone. But who has questions for Dr. Romanek? Anyone? Anyone? I'll come around. Oh, Carrie does. There you go. Oh, okay. Jim, catch.
Testing, testing.
All right. Got to speak up right into the middle.
So you talk about engagement with the public, and as I view that, I think about personal one-on-one. But I think one of the difficulties during the last pandemic was because we were living in a different world of mass communication via the internet. Do you have any thoughts on anything in regards to that? Because I see that as a real danger to misinformation.
So it does make it harder to communicate and connect to people when you're all wearing masks, obviously. Unfortunately, when we are in another pandemic, if it's a respiratory human to human, we will be in that same situation. We will unfortunately all be wearing masks just to keep ourselves safe, and more importantly, to keep others safe. And we will be forging relationships on Zoom calls, one-on-one. My recommendation is to do it before. Do it now, when you can get to know the person, so that once we're in that place, it's not nearly as awkward. Everybody's going to be wearing a mask and nobody's going to be happy, but you'll have those relationships that you can already lean on. It also makes getting things done significantly easier if you already have the relationship before you're in an emergency situation.
Thank you. Maybe one more question, because it's really still hard to hear over on this side. Oh, okay. Coming through. Hi, Alex. All right, got to speak up real loud.
Hi, thank you for your talk. It's been amazing. So my question, you spoke a lot about needing to stay connected globally and whatnot, but public health, as we know, yes, the pandemic or the terrorism is global, but we all know that the response is local. And without that global stream, how do we get to that local level and develop those local relationships when, I mean, most recently, the funding basically was yanked out from under our feet. With, after 9/11 and the anthrax attacks, we got an influx of money, and we were able to stand up a lot of preparedness, networking, and doing exactly what you're talking about. Grassroots, campaigning, connecting, relationship building. But like you also mentioned, vaccine hesitancy, that's obviously a lot harder and a lot more grassroots in the community versus emergency partnerships. So what's your suggestion besides like knocking on doors nonstop? Because granted, we're small, but we're mighty.
I like small but mighty. Small but mighty is sometimes the most efficient. With the recent funding cuts, my previous job a few jobs ago was working at CDC, by the way. So I'm well aware of the funding cuts you're talking about. A lot of the programs that I'm talking about, your public health department will be able to continue. The others that you're not able to continue, you have relationships with partners that you don't even realize that will be able to help you continue with them. You guys will not have the funding to do everything that you guys did before, which is the biggest blow to the United States specifically. And the public health departments are going to take the biggest hit by far, whether it's county, city, or state. But you have those relationships with others that will be able to continue on. With CDC, I've seen this happen a lot so far. A lot of their contracts have been canceled, and they have reached out to NGOs that were working on the same project to try and still keep those communication lines alive, specifically with their international partners, because they may have known what was coming, perhaps. And they've been able to do it through a conduit of an NGO, or in some cases, They had projects with Bill and Melinda Gates. So there are ways to do it. You just have to be creative and innovative. And I'm not kidding. It's going to be 10 times harder doing it that way. So tough answer, I'm sorry.
Okay, well, given the audio issue, I think we're going to move into student awards. One more round of applause. Thank you, Dr. Romanek, for being here and your thoughts. Okay. And again, the CEUs are still available. You might want to go listen to the live stream recording. You're able to get CEUs for nursing, MLS, PACE, CHES. I'm missing one. And REHS, yes, Environmental Health Specialist. Thank you, Sharon. Here's the code. I will email this to everyone tomorrow as well. You can try to scan that right now with your phone if you want. This will be available also after the breakout sessions. You'll be able to evaluate the breakouts separately, but you could evaluate Keynote right now. You can put in there how the audio was bad, and we'll work on that for next year. Hopefully we'll get a new amp on this side of the room. Again, sincere apologies. Ask Carrie for your money back. No, it's free, so hey, at least that would go. And we got lunch, so we're going to move into the student awards portion. And please, round of applause for Carrie Hamady, the Department Chair, Public and Allied Health.
I can do that. All right, thank you. Is Grace going to be our first? All right, thank you. My name's Carrie Hamady. As Phil said, I'm the Chair of Public and Allied Health, and I'm really happy to be here today to recognize our outstanding students in Public and Allied Health. This is really a great accomplishment for our seniors and grad students. So we're going to start with Grace Robke. She is our outstanding senior in Public Health. Her proudest moment is being on the Dean's List. Grace, are you here? Oh, come on up. She's also on the club rugby team, and so that's really exciting. So her plans after graduation are to move somewhere warm. I think we can all relate to that after this winter. So congratulations to Grace. All right, our next outstanding senior is Aaron Deutsch. Come on up. He is our outstanding senior from Medical Laboratory Science. He is a member of our 1040 a cappella group, which I think is amazing. He must like the color purple because I know they wear that all the time. But some of his proudest moments are becoming an ACE certified group fitness instructor and presenting his research at the KERS Symposium. So we'll get to see him next week at KERS. Congratulations, Aaron. Next up is Riley Conrad. She's our outstanding senior in healthcare administration. Riley? Oh, okay. I just want to point out that she earned 23 credit hours while completing her full-time internship. So that's really impressive. So congratulations, Riley. Our next outstanding senior is Shelby Noveski. She's in our dietetics on-campus program. Here comes Shelby. Her proudest moments are that she presented her senior capstone project at a conference. She's also organized a food waste prevention initiative between Einstein Bagels and the Falcon Food Pantry. So that's really exciting. Thank you, Shelby. And we'll also identify a few people we know are not here. Taryn Gustafson is a senior in our dietetics online program, and she just wanted to say that working full-time as a WIC employee while doing our online program really helped her with her time management skills. We also have Gabriella Matney, who is an outstanding master's student in food and nutrition. And she has some advice that you can do anything you put your mind to. Perseverance and a positive mindset will get you further than you think. So for all the students, or anybody, I guess, in the audience, that's some good advice. So thank you to all of our students, and congratulations.
Thanks, Carrie. Okay, well, let's back up a little bit here. So we're going to move on to lunch here, and I'm happy to announce it's allergy-free, so no worries for anyone with allergies or food restrictions of that kind. So you can feel safe to enjoy the buffet. We're going to get that going in about 5 minutes. I think catering is going to dismiss the tables too, just to keep it orderly. So please, for the next few minutes, just chat at your table. There is now water available and iced tea. You could go get a drink. And then I'll be back at 12:55 to dismiss to the breakout rooms. Okay, enjoy lunch.